Head-on collisions. These have a great potential for injury to all parts of the body. Two types of injury patterns are likely: the up and over pattern and the down and under pattern. In the first pattern, the patient follows a pathway up and over the steering wheel, commonly striking a head on the windshield, especially when he was not wearing a seatbelt, causing head and neck injuries. In addition, the patient may strike the chest and abdomen on the steering wheel, causing chest injuries or breathing problems and internal organ injuries. In the second pattern, the patient's body follows a pathway down and under the steering wheel, typically striking his knees on the dash, causing knee, leg, and hip injuries. Airbags are designed to deploy in front-end impacts. Airbags have a significant role in the prevention of serious injuries and may actually cause some injuries, albeit minor, themselves. If an airbag has deployed, be sure to move the deflated bag so you can fully examine the steering wheel. Remember that airbags deploy only once. If there were subsequent impacts, they would have offered no protection to the patient. Rear-end collisions. These are common causes of neck and head injuries. The law of inertia states not only that a body in motion will remain in motion unless acted upon by an outside force, as discussed earlier, but also that a body at rest will remain at rest unless acted on by an outside force, such as being pushed or jerked. This explains why neck injuries are common in a rear-end collision. The head remains still as the body is pushed violently forward by the seat back, extending the neck backward, if a headrest was not properly placed behind the head. In a head-on collision, an unrestrained person is likely to travel in A, an up and over pathway causing head, neck, and chest and abdominal injuries, or B, in a down and under pathway causing hip, knee, and leg injuries. A deploying airbag can also cause injuries. Side impact collisions, broadside or T-bone. These collisions have other injury patterns. The head tends to remain still as the body is pushed laterally, causing injuries to the neck. The head, chest, abdomen, pelvis, and thighs may be struck directly, causing skeletal and internal injuries. Many vehicles are now equipped with side impact or side curtain airbags, which are designed to protect occupants from side impact collisions. Rollover collisions. These can be the most serious because of the potential for multiple impacts. Rollover collisions frequently cause ejection of anyone who is not wearing a seatbelt. Expect any type of serious injury pattern. Rotational impact collisions. These involve cars that are struck, then spin. The initial impact often causes subsequent impacts. The spinning vehicle strikes another vehicle or a tree. As in a rollover collision, this can cause multiple injury patterns. In a rear-end collision, the unrestrained person's head is jerked violently backward first, and then B forward, causing neck, head, and chest injuries. An important aspect of mechanism of injury determination is to find out where the patient was sitting in the vehicle and if he was wearing lap and shoulder belts or if airbags deployed. You will often be able to observe important clues regarding mechanism of injury before you even exit the ambulance. At a head-on collision, for instance, you can anticipate the up and over or down and under injury patterns for a driver who remains in his car, and multiple injury patterns for a driver who is thrown from his car. For both patients, anticipate external injuries from the collision of the body with the auto, interiors, and pavement, and internal injuries from collision of organs with the interior of the body, as well as from external blunt force or penetrating trauma. When a patient appears to have been the driver of a vehicle, look for damage to the windshield, steering wheel, dash, and pedals when you are able to do a close-up inspection. You should also observe for damage to other interior surfaces, which might indicate there were additional passengers or patients. Injuries involving motor vehicles and all-terrain vehicles also have the potential to be serious. These vehicles offer the operator and passengers little protection in the event of a collision. To determine whether the patient was wearing a helmet, that was offered some protection from the head injury. Also, attempt to determine whether the patient was ejected. In some cases, the operator will be thrown from the bike and strike and severely injure his hips, thighs, or legs. Falls. Falls are another cause of injury where the extent and pattern of the damage may be determined by the characteristics of the fall. Important factors to consider are the height from which the patient fell, the surface the patient fell onto, and the part of the patient that hit the surface, and anything that interrupts the fall. In a rollover collision, the unrestrained person will suffer multiple impacts and possibly multiple injuries. The characteristics of a fall may provide valuable clues to a patient's injuries. Rollover collision. Side impact. A side impact collision may cause head and neck injuries as well as injuries to the chest, abdomen, pelvis, and thigh.